Begin the sternocleidomastoid release by identifying the muscle. The muscle is inhibited by grasping or pinching the muscle and moving it away from the underlying vessels. The muscle can also be moved either passively or actively by tipping the chin towards the torso. Release is accomplished by inhibiting motor tone in the muscle. The release can be done on one side at a time or bilaterally. The next release is pectoralis minor. Begin first by softening the pectoralis major muscle tissue. The pectoralis minor can be accessed through the pectoralis major as shown. This close-up shows positioning of the hand under the pectoralis major and on top of the ribs, accessing pectoralis minor. The client can move the arms as well, or the massage therapist can passively move the arm through various ranges of motion. The subscapularis muscle often shortens, and the motor tone can be inhibited by using a 45-degree angle of the hand into the axilla between the pectoralis major attachment and the latissimus dorsi attachment and up against the fossa of the scapula. Be careful of the brachial plexus nerves. Once the belly of the muscle is compressed, move the shoulder into internal and external rotation. The main muscle mass of the latissimus dorsi is compressed as demonstrated, and then the shoulder is moved either actively or passively. The suboccipital muscles are best addressed with the client in the side-lying position using the forearm as demonstrated. Pressure is applied at a 90-degree orientation. An alternative method can be a 45-degree approach with the stabilized hand while the client moves their head in a circle. The psoas muscle responds well to inhibitory pressure, but it is difficult to palpate. The pressure has to move through the abdominal muscles and the abdominal viscera. To perform this release, the massage therapist can use either a braced hand or a loose fist. The client is positioned either in the supine position, or the method could be accomplished with the client on their side. The diaphragm muscle attachments at the ribs can be addressed with inhibitory pressure as demonstrated. Be very careful to not apply excessive pressure along the ribs or over the liver. 90-degree pressure into the linea alba also affects the diaphragm muscle. Compression of the lower ribs is part of the release, as is extension of the lower ribs. The rectus abdominus attaches at the symphysis pubis and responds to inhibitory pressure. It is activated as the client does a sit-up. Attachments at the ribs are also treated with inhibitory pressure. Then the muscle itself is massaged. Inhibitory pressure of the proximal attachments of the adductors and hamstrings is demonstrated using a 45-degree contact with a braced hand. Compression of the hamstrings is effectively applied by kneeling as shown. To facilitate the release, movement can be added by instructing the client to move their knee back and forth. The broad-based compression applied in this manner is most comfortable for the client. This method can also be effectively used on the calf. The paraspinal muscles are the intrinsic muscles of the spine that attach one vertebrae to the other, and they often become short. By positioning the client in the sideline position and leaning into the area with a braced hand, the muscles can be located between the spinous process and the transverse process. A combination of compression and friction is used to address these muscles. The sartorius muscle is best addressed by applying inhibitory pressure to the muscle attachments and then having the person activate the muscle as shown.